I did my toes, a pedicure at home, and I went about my business. And like a couple of days later, I realized my toe was getting swollen. I only thought the one toe probably had to go. When I got in there, they looked. They said I had an infection that had spread from the original toe, like underneath my toes, into like the other two toes. I couldn't wear regular sneakers. I had to wear like a size bigger in my Uggs to even walk around. I was like, okay, yeah, they're just gonna take this one toe. I went in with that mindset already, but when I got into the emergency room and they actually looked at my foot and they were like, oh, all three have to go? I was like, wait, all three? I've had diabetes since I was in 7th grade, at the most awkward time in my life where, no, you don't want to go to slumber parties and have to stop and take insulin before you want to eat popcorn and watch movies. So like, I have rebellious moments even at 30-something years old where like, I don't want to do that. No, I want to eat what everybody else is eating without having to really stop and check my blood sugar or take insulin. For me, with my son, me being more concerned about him, it was just like, it's me and him. If I have to heal, one, I can't take him to school, I can't walk him to school, I'm missing out on things. My son was learning how to ride a bike without training wheels, so I couldn't do the whole helping him balance. I just was upset because it was like I felt like I was taking from my son in that moment and not being able to be there because I was healing. It is important for people who have diabetes to like actually follow through in doing what they're supposed to do, because again, like, you can become an amputee of diabetes, you can become visually impaired due to diabetes. Like right now, the reason I have on my Lovey Cute sunglasses is because I'm visually impaired. I have a cataract, but because I'm diabetic, that's also playing a factor in why, like, if your numbers are out of control and you have cataract, you can't get eye surgery because most doctors won't treat you because your numbers are out of control. I live in the world of 24/7 of being a mother, and so the fact that I live like that, I should have and should take my health very serious.
Instead of me just taking the proper precautions to let somebody know, I just pretty much played the sucked it up role, just played it how I wanted to play it, still worked, still was going about my day-to-day life. Finally, I got a little spell in the hospital. Before I even left the hospital, by this time my foot was like purple, it was all swollen, it was really bad. Like I couldn't even put my shoes on, it was always hurting, things like that. So when I was in the hospital, before I even got discharged, the nurse saw my foot. As soon as they saw my foot, they were like, yeah, no, we can't let you go. The doctor came in, pretty much as soon as they saw it that same night, they told me they were gonna have to amputate. Not only they were gonna have to amputate, they were gonna have to amputate my leg. You know, there's two types of amputations, between below the knee and above the knee. So they told me I had to go above the knee, which was a shocker. They told me if I wanted to stay alive or if I wanted to continue living and things like that, the leg would have to go. So no hesitation, that same night, I had to go. I'm always the kind of guy who's always gonna try to test the waters. I'm like, hey, okay, well, that happened to that person, so what's the chance it may happen to me? Let me go and see what I can do on my own. But unfortunately, that's what I paid that cost, and I was just a shock of, okay, well, now I have to just readjust my life, especially me being a new father, me trying to think about the future. Just had to kind of, now the future was kind of like hitting me because I thought I had more time to. And I think that's our biggest mistake, is we always thinking that we have more time than we actually do to actually handle what we need to handle. People always assume that we need help. I want to be able to have that ability to be able to allow myself to ask you if I need help, or we can be able to conversate with each other. So allow me to show you that I can do it. I can still do it, regardless of whatever, how big the task is or how small. Just allow me to give me the opportunity as I would you, or if I was normal. Because if I was a normal man, just standing here with 2 legs, 2 arms, everything I was supposed to have, you wouldn't give me a second look.
I like helping her because she has fun when she's around me, and I just like seeing her happy.
I think my dad is my best person I have right now, and it's still okay that even though he has 1 leg, it's still okay